when we hear the kind of horror stories at RUH and hear numbers of people being used that are spending time and being treated in the hallway there in Pod E and Pod F, I think it's really, really important for us to have personal stories that show us that the impact of those numbers and those people in the hallway, so they're not just sort of like faceless people, so we understand how that hallway emergency care is affecting people's lives. So if you could maybe tell me a little bit about what you know about how you ended up in RUH and what was your kind of and why you were in the hallway.
Well, it was a week ago, Wednesday. I had called 911 because I couldn't breathe and was transported to Watrous, where they did some stuff here, and then they transported me to the RUH. That happened to be the third time in the last couple of years that I've had to call 911. But when I got to RUH, my hall stay this time to get into admitting it was only maybe an hour, which was, compared to the previous time, was quite short. Into an observation room for about a couple of hours. And then they said they're moving me, which I thought nothing of. I thought I was being sent to a room, out into the hallway.
And did they tell you why they were putting you in the hallway?
They never said much on that, no.
And did you, because obviously you are immune compromised, so yeah. So what does it? Did you ask? Did you mention to them your health status and that being in the hallway might not be the best for your health?
First of all, I got to commend the nurses, are fabulous. Mm-hmm. The doctors, all of those people are great. The situation in the hallway is, for me, it's traumatic because I have been avoiding everybody for the last couple of years because of my lungs, and a cold would kill me. So being stuck in that hallway is just not a place I wanted to. I almost to the point of panic. I asked the nurses, I said, I don't want to be here. And of course they're still hoping that I'm going to get a room.
Yeah.
They don't really, they don't know what, they're so busy. They're so busy, those poor nurses in the hallway. It's just, but it's the amount of people. It's bright, it's noisy. That's the hallway I was in. At the end of the hall is the double doors to everybody from the inside emergency gets transported on beds to the main building.
So they
through
go
that hallway, yeah.
And so you mentioned you counted. You were trying to count how many people passed you.
I tried, but I'm sure I'm exaggerating it to 2,000 people, but I went out at about 8 o'clock at night, and my next round of IV wasn't till 1 in the morning. But it's so bright. It's like having a spotlight on you in that hallway. It's the brightest place I've been, way brighter than in the emergency room itself.
Yeah.
So there's 11 or 8 people in a row. There's very little room for the nurses to work, so you can hardly get a table beside your bed to put your phone on or anything belongings you have. There's
like a way to charge your phone or something.
There's none of that.
Oh, good.
There's none of that. So
so you mentioned, and I think I read something where you sort of feared for your life.
Absolutely. There's no. I was petrified that if I catch COVID, I think I'm dead. So those fears are in your head all the time.
Yeah, and so there's also when you're in the hallway, you mentioned running out of oxygen at one point, and so did you have access to a call bell to alert?
No, there's no call bells.
So if you had stopped breathing, or was there a way for you to notify people of that?
I was lucky enough. Well, if you call it lucky, my bed was right beside the nurse's station, so they were 3-4 feet away from me.
Okay, that's good.
There was pretty near somebody there all the time. That's when they weren't administering, they're doing bookwork. The bookwork those people have to do because they're out in the hallway and they have no access to computers is amazing. But
Yeah, so if you had been a few beds further down and run out of oxygen, you would have had no way of letting the nurses know that you had no way to breathe.
No, other than waving your hand in the air, which
You're
I
in
would
a
have done.
hallway. Good.
But there's no privacy. I can't get up and go to the bathroom.
So is there
So I have to use a
washrooms though?
urinal. There's no washrooms there.
Oh my word! So
So
you're
I have to
going
use a urinal, and I have to do that.
in front of.
I have to try to use a cover to cover myself up to be able to use a urinal.
So-
You know what I mean? And that's,
So you're forced to. So you're telling me in this hallway, people are forced to go to the washroom.
whoever can get up goes.
But if you can't get up, you're forced to go to the washroom in your bed in a public hallway while people are walking by.
True.
My lord.
I'm an old farmer, so we'll go into anywhere we want. So,
Well, yeah, but this isn't the third tree on your left,
and I'm
right?
an old guy, so you know what?
This is still a hallway in front of other people.
If you got to do it, you got to do it. So,
Yeah, fair. I mean, but
that's not right.
that's absolutely horrible.
And the other thing is, I did overhear nurses behind me. I'm not sure how far back it was. I think there was 2 beds behind me or 3 beds behind me. I overheard them say, "We shouldn't be doing this procedure in the hallway." So you wonder, I'm sure it has to be done. I'm sure they did it, but they question themselves, of the ethics of what they've got to do
For sure.
in that environment. So that environment's it's not a safe environment.
Yeah, I think that the letter that was released yesterday, and again, I think it's really great that you're inviting us all into your home so we can put a kind of a personal face on the conditions there. But I mean, that's part of it in the letter that was signed by 450 people that were caring for you. They described the care they're providing to you as unethical. Which is, I think, it is part of the reason why we're having problems recruiting and retaining people in RUH is people don't want to provide unethical care. They went to school, to be able to help people, not to do something that is dangerous and unethical. Yeah.
The nurses should be applauded for what they do.
Yeah, 100%.
But we're going to lose a lot of old nurses
100%.
because they're worn out.
Yeah, well, and young nurses too. Yeah.
Well, true. Or they'll move to someplace else
Yes. Yeah.
when we should be bringing people in if we can.
So what would you like to see come out of this?
Well, I've done a lot of thinking about it, and we need to get our hospitals in rural Saskatchewan, like Watra's, up and running. They can take a lot of the pressure off of, if you take all the rural hospitals and get them back to where we had them years ago, they could take a lot of pressure off of the big hospitals in the cities like RUH and Regina General, et cetera, and all of those places. So we need to things need to be changed. We need more nurses. What it's going to take to get that, I have no idea.
Yeah.
But we can't have people in hallways. And believe it or not, how horrible the hallway I was in, one nurse told me there are worse hallways in this hospital. And I can't imagine what that would be.
So just as I was driving up, I was listening to Question Period in the Ledge, and ironically, as I was walking in the door, one of my colleagues was asking questions about you and the care that you received at RUH, and the health minister's reply seemed to be to suggest that they had a plan, the plan was being implemented, and that that they were basically doing enough to help people such as yourself. I guess, what's your reply to the Minister of Health when he says that the government is doing enough?
Bullshit. Sorry to say, but unless you're going to bring in the nurses and do your consultation and come to a plan with the healthcare that are actually on the front lines in those meetings to discuss and design a plan, I don't think anything's ever going to change. Yeah. They need to be involved in everything.
Yeah, I
they know what is needed.
100%, yeah. And that's something I've certainly challenged the minister, is to go to RUH, to tour the hospital, talk to local people. You know, I often, Minister Cockrell will say, uses the line, we have the most ambitious recruitment strategy of anyone in the country. And you know, I kind of like to use the cheeky line, say, well, you know, I have the most ambitious workout regimen of anyone in the legislature. I haven't gone to the gym yet, but I tell you, I have ambitions. I mean, really, we just want it fixed.
That's like me. I need to exercise in order to be able to qualify to get my lung transplant, but
Yeah, I guess that's the
I
other
haven't
thing
got
that's
out and
kind of,
exercised yet.
I guess that's the other thing that's on the line, Guy, is that you're waiting for a lung transplant, and if you got sick then and caught a cold, that would prevent you from getting a lung transplant.
Oh yeah, there's no doubt about that.
Yeah.
All my experiences when I've been taken to emergency here over the last couple of years have been, I have got IVs here. This last time though, they just basically, they didn't do an x-ray here, which they usually do to see what's going on. But I had just been in 3 weeks on the 3rd of October with an infection into emergency here. So this was 2 weeks later, I'm back again with another infection, which never really cured up. But I think I could be treated here for my infections if, providing a doctor gives me the intravenous drugs it needs to attack the infection. So I would like to be treated here.
The town of Watrous is actually probably, because certainly an issue that we've raised is again around notification, and the town of Watrous is excellent in that they have posted these. There's other communities where if the town doesn't post it on Facebook, you don't know if the hospital's open or closed. We've caught the SHA, I think it's 5 or 6 times now, directing people to closed hospitals. Mm-hmm. So an example would be Outlook and Davidson are closed at the same time. They post a note on the door and they tell people from Outlooks to go to Davidson, even though Davidson isn't open.
Wow. That could be life or death to have somebody in an ambulance.
Yeah, it's really bad. Yeah, it's very, very, very bad. There was one 2 weeks ago where I mapped out that if you actually followed the direction of SHA, you would have traveled almost 200 kilometers before you reached an ER that was open.